one of the questions was, can you catch up your sleep over the weekends?
That's what I was
Answer
wondering.
this yourself. Answer it. Take a minute to pause it. But the answer is no.
No, you can't. Yeah.
Because, okay.
It's like a 3-to-1 ratio of sleep debt.
Right. But also, like, think about it logically as well. We have a 7-day cycle purely because of, why do we have a 7-day cycle? Was it Caesar's time or something? Some sort of thing. This is the structure of our week, right? It doesn't like permeate into our physiological sort of systems and stuff. So how can you expect a 7-day cycle to be resetting your physiological clock? It doesn't make sense.
Yeah.
And it does not work like that.
Welcome back to Subcut, the medical-ish podcast where we talk about things that will be interesting to any high schooler, medical student, or doctor, or just anyone who's interested in the field of medicine and healthcare. My name's Justin. I used to be a doctor.
My name is Emma. I'm a third-year physiotherapy student.
Hey guys, my name's Niel. I'm a fourth-year medical student.
And today, we're going to be talking about a pretty big topic. I feel a lot of people will be able to resonate with this, and it's sleep deprivation. And I know Justin and I have a pretty extensive history with sleep deprivation. Neil?
No, I sleep like a baby most nights.
Good for you.
Yeah, I love my sleep.
But I know as a university student, a lot of people struggle with this, but I think also with doctors, but I'm not too sure if that's just a misconception or not.
No, yeah, definitely. There's a lot of sleep deprivation in not just doctors. Like, it starts young. You know, it starts from the first year pre-med, it goes all the way through medical school and then permeates in through everyone doing their random shifts and trying to sort their sleep cycle out. But I think most people, as they get more and more used to it, they don't really suffer with this as much anymore. Like, personally, my main issues with sleep deprivation were definitely earlier on. Like, my sleep was real bad in sort of first, second, and third year. And then it progressively did get better, but it was a struggle for me. It was like really a struggle. It was very dangerous for me. But like, what's your history with sleep dep?
I mean, it's pretty similar, to be honest. And a lot of the time, people will ask you, like, what's causing it? Are you stressed? Is it because you're worrying about something? Is there something that you're thinking about when you're in bed? And for me, unfortunately, it was none of those things. And my sleep hygiene was really good as well. But I still couldn't sleep. And the way that I explained it to people, and people still find it hard to understand, is that I was thinking about the most random things. Like, I could be thinking about why a banana peel is yellow or something like that. And I just wouldn't realize that I was awake, like, for hours. And then some noise would happen or something would shift or I would need to go to the bathroom. And then I'd be like, wow, I've been awake for 3 hours now. And that's why people don't really understand it, because usually I feel like when you have insomnia, it's associated with stress or something like that. But I had really bad insomnia for about 2 years. I got put onto sleeping pills and everything. Sleeping pills didn't even work for me either, which was just then, at that point, it was like, what do I do now?
How was it affecting your life, though?
At the start, it's really hard. I don't know if you would have a similar experience, but at the start, you feel, how you usually feel when you skip a day of sleep, or when you're just a bit tired. But after a while, it actually became normal for me. And that was the scariest part. Like, I just felt I was in my body, but I wasn't aware of what was going around me, if that makes any sense. So an example I always give to people was one day, which don't ever drive if you haven't been sleeping, but I just hadn't been sleeping for such a long time that I was like, oh, I'm just going up the road, it's fine, it'll be okay. Don't do that, it's wrong. And I'll tell you why. And it's because this one time I was up the road at a restaurant with my friend and I was reversing. I saw this big cement block. I talked about the cement block to my friend. I was like, hey, there's like a random big cement block. Why is that there? And I was talking about it, I was looking at it, and I still reversed back into it. Okay? And it was just because, to me, my head just didn't make the connection with like my reality, if that made any sense. Because this was about 6 months into me not sleeping, like getting a max of 2 hours or something per night. And it kind of just becomes your new normal. Well, to me it did at least. I just was in my body, but I didn't know what was going on around me. And that made things like university, work, dealing with anything to do with life really hard.
Yeah, and it's no surprise. I mean, in a nutshell, you're just more prone to making mistakes and stuff. Yeah. That's a serious issue that I think a lot of doctors and stuff worry about as well, and that we should worry about. But it was funny that you said most people tend to ask, oh, what's causing it and stuff, because that was literally going to be my next question before Justin was saying anything as well. But yeah, like you said there, I always think of like sleep deprivation as having some sort of sinister cause or at least a solvable, like an easily solvable. That
was what the worst
trigger
part was, because there was nothing to solve.
Right, yeah.
Even the doctor was like, what?
Yeah.
And I was like, I don't know.
And that might just be specific to in your case and stuff, but I know like at least in other cases there are several other more sinister causes and stuff. What was interesting though is that, Justin, when you were saying the sleep deprivation for you had like early on causes in first, second year and stuff, and then it got better. And then it probably got worse in house officer years as well. Yeah. But I mean, obviously those causes would be different in that way.
Yeah.
Wait.
Let's wait.
Do they overlap?
Let's just go back, Emma.
Are you trying to diagnose me?
No. If we fast forward a bit, how did you solve it? Is it still is this like your present reality? Like, I had sleep deprivation. I'm having sleep deprivation.
No, I had sleep deprivation for about 2 years, and I was honestly averaging a good deep amount of deep sleep for about, I would say, 10 to 12 hours per week or something like that for a while. And you're supposed to get 8 per night, right?
I think deep sleep you don't need as much. Deep, like the deepest sleep, I think you're looking at trying to optimize like 4 to 6 hours of deep sleep, which
per
would
night?
be good. Yeah.
Okay.
Per night. Yeah. So you would be doing like 20. So you were still definitely under.
Like it was like I was awake, but I didn't know I was awake. So it was that light sleep, but just all the time, and it was only for it was all the time whenever I did get the light sleep.
So how did you actually overcome
It actually
that?
just went away.
Oh well, okay.
I got put on sleeping pills, everything. Nothing was working. I doubled my dose of sleeping pills. Nothing worked. And then one day it just went away.
Was that
slowly, but it went away.
The sleeping pill that you on? Are you talking about melatonin?
I was on Zopiclone.
Zopiclone, yeah. So I mean, we'll talk a little bit more about. So if anyone's watching that's having the same problem, don't just straight away turn off of this now. We will talk about it in a little bit more depth. And if you're watching on YouTube, then obviously hit that like button.
Okay.
But that's gonna cure your insomnia. I don't guarantee that.
It's not medical advice.
So, my experience with sleep deprivation, because I think that actually ties into a solution.
Oh, really?
For people. Because this is a problem that obviously a lot of my students will have as well, because they're all in these high stress environments and whatever. And so that racing thought mentality is pretty common, I think. Like a lot of the time, first of all, I think it's important to say that a lot of the time it is caused by things like stress or having a lot of things going on, or it's exam period, or there's things happening, or the really common one is people don't have good sleep hygiene. That's a really common one, right? Like they'll be on their phone in their bed, they'll be exercising really close to when they go to sleep, there'll be lots of like blue light, the other common ones will be napping during the day is a really big one. We're not getting enough exercise, because exercise is important to just kind of hormonally regulate and things like that. So those are sort of basic things that most people should get done first before they say, oh, my sleep is incurable. And a common misconception about that, which I always tell my students, is that if you're struggling with poor sleep, then the important thing is not just to do like one of those things. Don't just have a blue light filter. Don't just kind of not study in bed. You should be doing all of those things. If there's a problem, you should be not studying in bed and not having the blue light and getting exercise, but not too close, and not having caffeine sort of 5 to 6 hours before you go to sleep.
Blackout curtains.
Blackout curtains is a big one. Yeah, lights are really not only getting to sleep, but the depth of sleep. You get deeper sleep when there's blackout curtains, things like that. So all of those things are really important. Niel, it looks like you had something to say for a while.
Oh no, not really. I kind of just felt guilty because I actually use YouTube to put myself to sleep, which is really bad.
You are so blessed,
but
honestly.
Yeah, like with horrible sleep hygiene, I still end up having a decent sleep. So I'm sorry.
You should be so nice.
I feel guilty.
I'm happy for you. It's honestly the worst.
no, but I mean, I've had particular instances, not like prolonged, here and there, trying to relate, where sleep was really bad, but like. Yeah, I think I sleep pretty well. Sorry, guys.
Thanks.
Anyway, back to you.
Yeah. I definitely, like, I used to do that a lot, you know, the whole watching YouTube in bed sort of thing. I'll still do that because my sleep is a lot better now, so I can get away with it more. But when it's bad, it's, you know, just like absolute no-go. Like, not even, you know, some people just say don't even carry your phone into your room with you. You know?
That's what's the most frustrating part. Well, from my experience anyway, is that I did all of the right things. And a lot of people, they choose to, for whatever reason, whatever's going on, like exams or whatever, they'll get into bed late and they know that they're going to get less amount of sleep. I used to go to bed like even earlier because I knew it would take me like 3 hours to go to sleep. And then I still wouldn't go to sleep. So I'm in bed for 12 hours or something. And that whole time I slept for like 2 hours. The whole thing is frustrating.
Yeah, there's even a sort of school of thought around that, is that you shouldn't actually try to go to sleep if you're not tired, because it sort of trains you to be in bed without being sort of sleepy.
But I was always tired. It always felt like I could go to sleep and then I'd get into bed and it was like...
Yeah, so that's kind of, that's sort of that insomniac sort of spiral, is that when you need to go to sleep, you can't go to sleep, but then you fall asleep in other places. So, you know, with me, there were clear issues why my sleep was all screwed up. If you haven't seen that episode yet, you know, on my first year, just go find that episode. Long story short, I didn't sleep pretty much at all. And so my sleep was really screwed up severely for a long time after that. And in my second and third year, it was just sort of like a continuation of that horrible deprivation. I was so sleep deprived, and my sleep cycle was so screwed up. That's one of the reasons I stopped going to lectures, is because I couldn't sit in a lecture and stay awake. I think probably starting from my second semester of first year through the end of medical school. Actually, more than that. Oh, there's this funny story I just remembered. So even more than that, because there are these things in hospital called radiology meetings. And so radiology is a...
Yeah. Oh, I relate so hard. Oh,
I don't know the story.
So just go. It's a universally... yeah, go.
Okay.
Go.
So radiology is it's a specialty of medicine that deals with medical imaging, which is looking at X-ray, CT scans, MRI scans. So you're doing these imaging studies that are looking at through people, right, to help in the diagnostic process. And so in order to see these, you need to see it in enough resolution and clarity to actually be able to tell, because it's just kind of grayscale. Not a lot of radiology has color coding on it, and a lot of the bread and butter stuff, like an X-ray, is really just different shade. They call it 50 Shades of Gray.
Right.
So you need to be able to tell if that blood is slightly darker than the surrounding tissue or something like that. And so you turn off all the lights.
Right.
And so in the radiology meetings, you have a very dark room with a projector on. And so for me, I can't even go to lectures, because sitting in a dim room around other people, like, I'll fall asleep. I can't even make it through the first lecture. You know, I'm asleep in the first 20 minutes. It's like a guarantee. That's my Zopiclone.
Yeah.
Literally.
Wow.
Yeah.
So Zopiclone, by the way, is the medication, Emma, that you were on, and that's it's a sleep medication that's really commonly used, probably the most commonly used. It's a non-benzodiazepine sleep medication, which means that it helps you go to sleep, but it's not within a class of medications which is called benzodiazepines. Benzodiazepines are really useful for anxiety and going to sleep. However, they can't be used prolonged because it causes addiction and dependency. So Zopiclone's not meant to do that. Having said that, actually, Zopiclone's not meant to be effective after using it for more than sort of the first week. So you're not really meant to be using Zopiclone for more than a week. And sort of double dosing on Zopiclone, it probably means that there's a tolerance going on there. So that's kind of not how it's meant to be used. Having said that, something like melatonin, which is not as strong but can be better at just helping you regain your natural sleep cycle, is not funded. So it's really expensive.
I asked the doctor for melatonin when I went in there initially, because I knew, I guess it's not as strong as Zopiclone would be. Yeah. So I thought that would be what he'd put me on first. And he was like, nah, just take the Zopiclone.
Yeah,
and I was like, okay.
when you're working at a hospital, it's very common to just be chatting Zopiclone. It's such a common, you know, because you're in a hospital, the patients aren't sleeping probably because it's that type of environment. So you just chat some Zopiclone and you're sort of done with it. It's a very, 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 very common medication that's prescribed. It's safe. Safety profile is really good on it, but it's not as kind of the magic pill as a lot of people thing. Really what you should be using Zopiclone for is get good sleep hygiene, get all the things right first, and then help you reset using Zopiclone rather than depending on it to get to sleep without, fixing the underlying cause. So for me being completely really narcoleptic, I was falling asleep.
What is narcoleptic?
So narcolepsy is sort of what happens when you don't get enough sleep, when you're really what's called like hypersomnolent, which is just really, really sleepy, and you fall asleep pretty much anywhere. You're really, really sleep deprived and you fall asleep anywhere. It's really easy for you to fall asleep, and often it's often paired with insomnia. It's hard to fall asleep at night.
Oh,
so that excessive daytime sleepiness.
Okay.
Yeah. So, you were mentioning, don't drive, and I know exactly what you mean. That sort of it's sort of a derealization effect, and that's actually the term that's used, is that you don't feel that you're connected with the present reality.
Whoa.
I used to get that a lot when I was in first year, when I was very sleep deprived.
Give a quick refresher.
Like 6 hours of sleep a week.
And what happened the year after that to your blood pressure?
That was my heart rate. So
it was the heart rate. Sorry.
Yeah.
Sorry.
So I was my heart rate was like just 90 to 100 at rest. Doing nothing.
Did you choose to not go to bed, or would you get into bed and not be able to sleep?
No, I chose that in my first year. I chose not to sleep because I just wanted to study.
And then the next year you were able to sleep, or you just needed to catch up a lot?
I wanted to sleep, but my body was just so screwed by that point. I just couldn't.
Oh, wow.
Yeah. So yeah, but don't do that.
Do not.
Definitely don't do that.
No.
If you hit the subscribe button, that's one subscribe, one slap to Justin. So if that works. So
yeah, but if you hit the subscribe button twice, it actually deactivates the slap. So you need to either hit it once or 3 times, or any odd number, in order to successfully do the slap.
Anyway. Embarrassed.
So yeah, like I remember some this is like really dangerous. I would fall asleep when I was driving all the time. Actually,
fall asleep.
Yeah, I'll be drowsy.
Drowsy.
I'll be kind of slipping in and out while I was sleeping all the time.
Yeah.
Almost every single time I drove, that would actually happen. I really should have stopped driving, but I guess like I don't know, just like IQ problems.
I feel like until something almost happens, you just
something
feel like it's okay.
Well, actually, so something almost happened. So I was driving home from a ski trip, and I was up on this windy mountain path, and I actually fell asleep on a curve.
Why did you drive to a windy mountain path? That's just so dumb. Like, you guys think Justin's smart? I have news for you. That's so dumb.
So I drifted across the line, and I was like my car my front wheel left the road and kind of dipped off the road, and then that jerked me awake, which I quickly turned, but I was on a curve. And actually, there was a car coming directly in that lane at that exact time. So that was really, 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 really close call. And after that, I was like, okay, I actually really need to sort this out, because it was one of those things that was like, it was bothering me at that point. Like, it was an issue for a long time.
Exactly. So you're just like,
it was like a new normal.
Yeah.
So it was like, this is it's really annoying, but I can't do anything about it. So I decided to throw the truck at the problem in terms of sleep hygiene. And that made a really big difference. Using Zopiclone more strategically, and trying to do a lot. Like, meditation was a big thing for that racing thoughts. Like, being able to just kind of meditate out, get my racing thoughts out, journaling, putting it out. So I've got this video on like a high efficiency sleep routine, and part of that is just journaling out. Like, meditate for a while, and when you meditate, it's almost like you open the floodgates for random thoughts to come in. And then you're like, okay, fine. And then you just note down all those thoughts. And then you do another round of meditation where you're just kind of at peace, and then go to sleep with no break in between. And that helped a lot with those racing thoughts. So spending like 20 minutes in advance to do that was able to cut out like 2 hours of just mindlessness in bed.
So sort of just get it out of your system.
Yeah, just to get it out of my system.
As a student as well, that kind of thing, like you say it's your new normal, but sleep is very important for memory, by the way, for anyone that doesn't know that. And not even being a doctor, but even just being a student trying to learn, everything takes so much longer, and it's extremely frustrating, especially when, you're someone that tries to do well in university, puts their best foot forward, it's like something that would have taken me 20 minutes is now taking me like 2 hours.
Like 2 days.
Yeah, because it just doesn't go into my head, and it puts you so far behind. And that year was actually, the year that it was the worst was such a hard year for me that was actually the year that I left Foster Our Future, which, by the way, if you didn't know, is this company. It's
a company that
umbrella.
It's a complicated story, but anyway.
Yeah. That year, it was just so hard for me that I was like, there's too many things going on in my life right now that don't need to be going on, like, that are absolutely essential. But I just need to make more time to do the things that are essential, that I have to quit this job that I love. And I actually left Foster Our Future because of it. So sleep deprivation really affects you. And it's especially frustrating when you're surrounded by people who are just so onto it. Like, if I was next to you, Neil, I'd be like, oh, shut up. Like, nope, yeah, you understood it straight away. Cool for you. Like, cool for you, you know. But I'm just like sitting there in a lecture theatre, just, you know, completely almost spaced out no matter how hard I'm trying to concentrate. And I can imagine as a doctor or as someone that's actually, you know, affecting other people's lives.
It's really unsafe. And you get that it's the same thing. And I think people really, until they get to a point of that sleep deprivation, they really do underestimate sleep. Like, there'll be a period of like 6 months or more where they're getting bad sleep, but then underestimating the effect it's actually having. But when you really look at it with that retrospectoscope and you actually think, how much efficiency loss and quality of life loss have I actually received from the sleep deprivation of the last 6 months? It's such a gradual decline, you don't even realize it. But
your baseline changes so slowly, and everything, we always compare everything to our baseline. So
exactly.
We don't even know that our baseline
we just
changing.
accept it. That's why I said it's like a new normal. It's like, I've been sleep deprived for 6 months, so I'm just going to drive now because otherwise I'm never going to drive.
Yeah,
you know?
Yeah, exactly. It's like those people wanting to get out of lockdown because they need to get a haircut. It's like, it's not an excuse.
Yeah, exactly.
So, you know, the ground rule is, you know, get good sleep. Do what you need to do to get good sleep. See your GP about it. You know, this is something that they can actually help you with. It is a medical issue. I would definitely recommend, and you might even need a sleep study. You might have sleep apnea. You know, you might have really large sort of bones inside your nose which stop you from being able to breathe properly when you sleep, which reduces your quality of sleep. There's lots of legitimate causes for this, and do those things. Look up sleep hygiene. Do all of those things. Do meditation, you know, do these things where the compound interest of it actually makes a real tangible effect. Sorry, that story with the radiology, what ended up happening was that the radiologist was actually one of the lecturers. And I was in the front row and I fell asleep. And in a radiology meeting, there's not a lot of people. There were like 8 people in that room.
Oh my gosh.
It's like a tiny room, like the size of this podcast thing here. There's a TV, there's a dark green. I'm in the front row and I'm like clearly trying to pretend like I'm like staying awake. Like, you know,
you do when you're like,
you know that position you're in, which is not quite like slouching and not quite sitting, where your head is like balanced perfectly on the top of your spine so as to like be able to relax and sleep. And he actually ended up like scrunching up bits of paper and like chucking it at me in the middle of the thing.
He's having a good time.
I didn't even know until the end, and then they told me, and there were like bits of paper at my feet. I was deeply sleeping.
Oh my gosh.
So. I have a very similar story as well, but my intention to sit at the front was to combat this like trigger of just the dark room. I'm like, this is my time to like lights out. So I sat right at the front. I knew the radiologist was right there in front. Our consultant was behind me, and we're all at the front over there. Right? I had my notebook out, I had my pen out and stuff. There's like, if I have to drop all of this, embarrass myself with 2 important people for me to like sleep. So I'm like, hey, the stakes are high. I can't sleep. My ass sleeps anyway. And that was embarrassing. And
over enough time, I think I actually trained myself to sleep in radiology meetings. So even as a house officer, it's like my patient, and I'm really interested. I'm like, I want to know what the deal is with this scan. Like, I've been waiting for 3 days to figure out what to do with this patient. You know, like my whole team, we've been talking about it every single day, every ward round. We're like, what are we going to do? Are we going to operate? What is it? Like, is there a collection? Can we drain it? And we go into this radiology meeting. And I'm like, yes, this is my patient. Like, I got to figure it out. And I'm like, come on, like, just hang in there.
I would pinch myself really hard. I'd pull my hair out.
It doesn't work. It doesn't work.
Oh my gosh.
Terrible. Inflicting pain to stay awake.
When the body wants to sleep, the body will sleep. That's one of the things you learn actually, you know, in medical school and when you become a house officer, is that's when your sleep drive is strong enough, there's nothing you can do to stop it. So you will always fall. It's just it's impossible to combat. So okay, wrapping up that thing, you know, if because it's the same. It's gonna be the same as a doctor, right? Like I remember on my 12th day of a shift where I don't even know what I'm doing anymore. Like I'm writing and I don't even feel present. Like I'm charting medications and I think I've already made 3 mistakes and it's 10 a.m.
Isn't that dangerous though? Don't you guys ever go like, oh, maybe I should ask for a day? I mean,
yes, but
can you ask for a day off?
Okay, number one, yeah, like technically, yes, it's a responsible thing to do. But number one, like it puts more burden on your peers. Therefore, it's like, okay, is that responsible to do? Technically, yes, but is it kind of like in a weird way frowned upon? Also kind of yes, like that's a weird cultural mix where you really should take the day off if you need to sleep, but it's kind of like, well, look, everyone's going through it. Like you kind of need to. So like for me, that was always kind of a difficult decision to sort of make. Like you kind of have to just you put up with it, you push through it. But everyone has different amounts of sleep they need. You know, some people only need like 6-7 hours of sleep. Some people need 8-9 hours of sleep. And if you're someone that needs 9 hours, you can't compare yourself with someone that needs 6 just because they're fine. They just need less. So I always try to make it so for my peers that they wouldn't feel bad. Like if they want to take a mental health day off, if they wanted to just do whatever, then like I'd be very happy to pick up the slack, because like for me, it just felt so awkward to, especially in like surgical runs where the culture is like just more intense overall. It's really hard to kind of just take a day off, even though it's unsafe. Really, from a managerial systems perspective, they should be staffing and rostering in such a way that, you know, and technically speaking, if you're not getting 8 hours between the end of your first shift and your last shift, at the beginning of your next one, you're allowed to protect your sleep time, technically, but no, that doesn't happen. In reality, it doesn't happen. And if you're especially a trainee on a program, like a surgical trainee for a competitive program, it just, it doesn't happen. You know, you'll finish a night shift, your shift ends at 7 or 8 a.m. and then you're going home at like 1 p.m., you know, because you want to spend more time in theater after that. And then you're coming back, you know, later that like you're getting, 6 hours sleep. So there's a lot of that sort of stuff is pretty rampant. There's no real quick and easy solution for sleep deprivation.
Yeah, definitely not.
What I will just say then, if there's no quick solution, is at least check the misconceptions, check and know where you are wrong in terms of your ability to fix it or what you think the causes might be. One common one I think I can think of just off the bat, because Tony Fernando, my guy Tony Fernando, we still need to get him on this podcast.
Yeah, we still do.
We still do. Anyway, he was giving us a lecture in neuro in third year, early last year, and it was a sleep-based lecture and stuff. And one of the things was he gave us like this little quiz that we had to do, and one of the questions was, can you catch up your sleep over the weekends?
That's what I was
Answer
wondering.
this yourself. Answer it. Take a minute to pause it. But the answer is no.
No, you can't. Yeah.
Because,
it's like a 3-to-1 ratio of sleep debt.
Right. But also, like, think about it logically as well. We have a 7-day cycle purely because of, why do we have a 7-day cycle? Is it Caesar's time or something? Some sort of thing. This is the structure of our week, right? It doesn't like permeate into our physiological sort of systems and stuff. So how can you expect a 7-day cycle to be resetting your physiological clock? It doesn't make sense.
Yeah.
And it does not work like that.
So can you actually catch up on sleep debt?
So sleep debt is an interesting thing, and there's ongoing research about this. So we know that sleep debt is cumulative. We know that cumulative sleep debt is seriously linked significantly to many comorbidities. And when I say comorbidities, for lay people, a morbidity is basically a state of reduced health in some form of capacity. So it contributes to like increased heart disease, increased obesity. It contributes to just death, early death. So I think there's studies saying that losing like an hour of sleep a day is the equivalent of like smoking like a pack of cigarettes. Like the effect it has is just ridiculous. It's such a huge effect. Well, it's like the same as being morbidly obese in terms of the risk to your cardiovascular health. So sleep debt is a real thing. It's cumulative. Can you combat it? Technically, yes, and technically, no. So in one hand, damage is already done. So can you kind of reverse that? You got to give your body the time to sort of heal in a way. But the amount that you need to heal to cover it is usually huge. So I've seen some conflicting studies on this, but some say that if you do an all-nighter, it takes anywhere between 3 days, and some studies I've seen say 2 weeks of perfect sleep to recover from one single all-nighter. So if you have reduced quality of sleep for, let's say, I don't know, 3 months, then, well, I calculated based on that, how long I'd need to have perfect sleep to recover from my first year, and it was like 17 years.
Can you make that comparison though?
I don't think so.
Yeah.
So really, it's
like a cool fact, like if you want to spit it out there.
Little
sounds cool. Yeah.
Yeah. So you kind of can, but it's in that gray area.
Yeah. It's not to scare anyone, but if you have the choice to sleep like Neil does, take it.
I should be taking it a bit more seriously. Yeah, yeah.
And it is
be
important.
there for your friends that can't because they're going through a hard time.
Yeah.
It is, yeah, it's serious. Like, take it seriously, really do something about it. Don't underestimate it. And I know that there are, students listening to this that are a little bit younger, high school, early years of university, and that it hasn't really, clicked through how important it is. So just, take it seriously.
One way to fall asleep, I'd say, would be to hit that like button once again and subscribe maybe twice. It's the third time we're like plugging.
No, 3 times. Yeah, odd numbers only.
We're trying too hard now. Sweet.
Anyway, thanks for listening, and hope you have a good night.
See ya.
Sleep tight. Thanks for tuning in to Subcut. If you guys have any suggestions for content, please make sure you send it through.
You can get in touch and follow us on Facebook, Instagram, and YouTube, or find us on our website at jttmid.com/subcut.
Subcut is a podcast brought to you by JTT. If you or anyone you know is interested in a career in medicine, make sure to get in touch and check us out at jttmid.com.